Hey everybody, welcome back to our channel. In today's video, we are diving into one of the biggest names in healthcare IT, Epic Systems. We will look at the main sections on the Epic website, explore tools like EpicShare, MyChart, Cosmos, and OpenEpic, and understand what they are used for. We will also cover Epic's software categories, interoperability features, and AI tools. By the end, you will have a clear overview of how Epic works and why it is used across hospitals and clinics. Epic Systems is one of the most widely used electronic health record platforms in the world, and understanding its structure is essential for anyone working in healthcare or health IT. To start, you need to go to the official Epic website. So open your browser and go to epic.com. Once the website loads, you will notice several sections that organize Epic's major tools and services. Each section represents a core part of the Epic ecosystem and helps users interact with clinical data, research platforms, patient portals, and interoperability tools. The first section you will see is EpicShare. This is Epic's main EHR community and the central platform hospitals use to manage medical records. EpicShare allows institutions and professionals to access best practices, collaborate with one another, explore project updates, and view documentation. It also contains training videos and guides. Think of EpicShare as a combined knowledge base and professional hub. You can learn new features, share workflow improvements, and explore updates released by Epic. It is one of the most frequently used sections for organizations running Epic across their hospitals and clinics. Next, you will find Epic Research. This section provides data-driven insights based on Epic's large global network of anonymized patient data. Healthcare providers use this information to support better clinical decisions, track public health trends, and review research on diseases, treatments, and population behaviors. For example, you can find studies related to infectious diseases, long-term health conditions, or disparities across communities. Epic Research helps medical professionals understand real-world trends using actual clinical data collected from Epic hospitals. Following this is Epic Cosmos. This is one of the largest anonymous health data networks in the world. Cosmos connects data from millions of patients and thousands of healthcare institutions. It supports large-scale analytics studies, comparative research, and clinical benchmarking. On the platform, you will find statistics showing the number of hospitals, clinics, and patients contributing data, which demonstrates the massive scope of the Cosmos database. Researchers and clinicians rely on this platform when they want to perform real-world evidence studies or explore patterns at a population level. The next section is MyChart, which is Epic's patient-facing portal. When you click Access MyChart, you will choose your region or healthcare provider, log in, and access your personal records. Through MyChart, patients can view lab results, test reports, medical histories, prescriptions, appointment schedules, and messages from providers. MyChart also supports video visits and wearable device integration. It plays an important role in improving communication between patients and healthcare teams, while giving patients direct control over their health information. Another major section is OpenEpic. This is Epic's API platform that supports interoperability by allowing developers, partner systems, and third-party services to integrate with Epic data. The platform follows the FHIR standard, which stands for Fast Healthcare Interoperability Resources. FHIR ensures that different health systems can exchange medical data smoothly. With OpenEpic, developers can build apps that connect directly to Epic's EHR, enabling features such as secure record sharing, clinical decision tools, and patient-facing applications. Hospitals use this feature when they want to integrate external software with their existing Epic workflows. Epic UserWeb is another important portal. This is a secure area designed specifically for Epic customers, including clinicians, administrators, and IT staff. UserWeb contains training materials, documentation, system updates, support forums, and downloadable software components. Access requires a UserWeb account and organizational approval. Institutions use this portal to train new employees, troubleshoot issues, download updates, or learn new features introduced in the Epic system. You will also see the Epic Showroom. This section highlights innovative apps, partner solutions, and external tools designed to work with Epic software. Third-party developers often showcase their integrations here. Organizations can explore different add-ons to improve their operations, whether for billing, analytics, patient engagement, or clinical workflows. Now let's look at Epic software categories. Epic is used by a variety of healthcare institutions, and their software offerings are divided according to user needs. The first category is standalone specialties. These are EHR modules for individual medical specialties, including dental, orthopedics, oncology, cardiology, nephrology, and urology. These modules are often used by independent clinics rather than hospitals. They include specialty-specific forms, workflows, diagnostic templates, and tools tailored to each field. Next is the Health Systems and Clinics category. This is the core area used by large hospitals, outpatient clinics, and multi-department health systems. It supports scheduling, care documentation, billing, reporting, and revenue cycle management. Epic's main software, called Hyperspace, operates in this environment. Hospitals rely on this platform for daily operations across primary care, specialty care, emergency services, inpatient units, and outpatient departments. The post-acute section refers to care provided after hospitalization, such as rehabilitation centers, skilled nursing facilities, long-term care homes, and therapy programs. Epic provides tools that allow caregivers to document patient progress, manage treatments, and integrate information with the patient's main hospital record. The Payers section is designed for insurance companies and health plan organizations. Epic allows payers to coordinate with healthcare providers using authorized data access. This supports claims, eligibility verification, prescription benefits, authorizations, and member engagement. The system helps create a smoother connection between insurers and medical institutions. Another important category is patient experience. This set of tools enhances the way patients interact with their providers. It includes features for appointment scheduling, medical messaging, medication management, and integrated dashboards. It keeps patients informed, connected, and able to participate actively in their care. Convenient care refers to walk-in clinics, telehealth services, urgent care centers, and retail health clinics like those found inside pharmacies. Epic provides fast workflows suitable for treating minor illnesses or injuries while still maintaining a connection to a patient's full medical history. Epic also serves life sciences organizations, including pharmaceutical companies, biotech firms, research institutions, and clinical trial centers. This section helps these groups access real-world clinical data for studies involving drug development, safety monitoring, and medical device research. It bridges the gap between clinical work and scientific research. Another component is care in the home. This supports home healthcare agencies that visit patients in their homes, conduct assessments, provide therapy, or monitor chronic conditions. The platform helps teams document visits, track care plans, and communicate with physicians while staying connected to the patient's main record. The Social Safety Net section is designed for public health organizations, government hospitals, and clinics serving underserved communities. It includes features for sliding scale billing, grant management, and integration with public assistance programs. Epic also includes strong interoperability features. These allow data sharing across different health systems using Care Everywhere and TEFCA support. This ensures that patient records can follow them even when they visit hospitals that use different EHR platforms. Interoperability plays a major role in improving continuity of care. The last major area is artificial intelligence. Epic integrates AI and machine learning into many of its workflows. AI supports predictive analytics, such as identifying patients at risk of readmission. It provides clinical decision support, natural language processing for documentation, and workflow automation. These tools improve efficiency, reduce administrative burdens, and enhance care outcomes. Finally, if you scroll down the Epic homepage, you will notice that pricing is not publicly listed. Epic customizes pricing based on the size and needs of each organization. To get an estimate, hospitals or clinics must contact Epic directly using the contact options provided on the site. Epic offers separate email contacts for media, patients, vendors, consultants, and other groups. Phone numbers are also listed for callers inside the United States. So that's basically the Epic Systems software tutorial. And that's it for this video. If you find this helpful, consider subscribing and giving this a big thumbs up. Thanks.